Hi, I'm Kristen here at UT Southwestern. Thank you for joining us this week. Today we are really excited to be joined by Dr. Karen Kowalske, who's a physical medicine and rehabilitation specialist at UT Southwestern and at Parkland, which we are super excited to be broadcasting from the Parkland Burn Clinic today. It's the first time we've been off of UT Southwestern campus, although we're technically right next door. So I want to thank both Parkland for letting us use their clinic, as well as the Texas Burn Survivors Society for helping us promote this chat. Now before we get started, don't forget to like the conversation and love it as we go along. If you hear something Dr. Kowalske says that you just love or that is very helpful, please let us know. And don't forget also to share the conversation. I know we're going to be talking about burn rehabilitation and treatment. I'm sure this is a topic that's going to come up a lot as we enter the 4th of July holiday. So one other thing, if you're having audio problems or visual problems, just refresh your browser. That happens periodically, and we are here to go. So, Dr. Kowalske, thank you for joining us.
It's a pleasure.
We're excited to be here. I know this, with 4th of July coming up, burns are definitely on the minds of a lot of people, particularly parents. And so I'm wondering if we could start with, when should people seek medical care for a burn?
So there are a couple of different things. In the burn community, we classify injuries that require being seen at a burn center as major burns. And so those are burns to the hands, the face, the feet, or the genitalia, or burns that cover more than 20% of the body. Okay. So that's the type of burn that should go to a regional burn center like Parkland. Okay. For smaller burns, the rule of thumb I use is if it's bigger than the palm of your hand, or if it looks like it's infected, okay, or if it looks like it's not healing, then you definitely need to see a physician.
Okay. So what should somebody do if it's one of those smaller ones that they can treat at home? I know there are lots of wives' tales out there about, use butter, use flour, assuming those are not right.
So there's some interesting things, and there actually has been some science around this.
Okay.
And it turns out that the very best thing you should do is it's usually your hand, it's usually something you've touched, is to put your hand under running water. And part of that is that the heat itself the water itself moves the heat away. So it's better than putting it in a pan of water.
Okay.
And the water temperature really doesn't matter as long as it's not hot, because the water, just tap water, is going to be cooler than the burn.
Okay.
For burns bigger than the palm of your hand, you don't want to do that, because after an acute burn, the body starts to lose its warmth. So if you take a shower, it will make you quite cold.
Okay. So does this work as well? Does this work with sunburns, or is this strictly for, you've grabbed something and it's really hot and you've burned your skin?
It helps with sunburns too, that cooling and helping dissipate the heat.
Okay.
If the skin isn't peeling, isn't draining, then you can just use a topical lotion. Anything that doesn't have perfume in it, cocoa butter, aloe vera, vitamin E are all fine.
Okay.
If the skin is broken, if there's a blister or the skin is draining, then you need a topical antibiotic ointment.
Okay.
To make sure the wound doesn't get infected.
Okay, all right, there you go. So one of the questions that people ask is, I've been burned, I've treated it, how do I keep from getting a scar? Is that even possible?
Have good parents. The biggest issue in scarring is really genetics. There are some people who are highly predisposed to scarring and some people who are not likely to get a scar at all.
Okay.
In general, people with very dark skin or people with very fair skin are the most likely to have raised scarring.
Okay.
There is a lot of mixed literature on ways to prevent it. The one thing we know for sure is that moisture helps.
Okay.
So lotion, lotion, lotion. People with dark skin, when their skin is dry, they say it looks ashy, and it might be what your knuckles look like in the winter. So if the skin looks ashy, it needs more moisture.
Okay.
That'll also help keep the skin from tearing.
Okay.
So for both of those things. There have been a lot of research on pressure garments, silicone gel inserts, and very expensive scar creams. None of those seem to work much better than just using the lotion.
Okay, all right. So we've got a question from Veronica here, and thanks for the question, Veronica. We talked about this a little bit, but she's wondering kind of when do you seek care?
So I would say if the wound is bigger than your palm, or if it's not looking like it's starting to heal in 3 or 4 days.
Okay, then you want to call do you want to call your physician or do you want to go to the emergency room?
If it's a small one, say like the size of a quarter, you may be able to just see your local physician. If it's bigger than that, you really should have your physician refer you to a burn center.
Okay, that sounds good. So speaking of burn centers, I know Parkland is one of the largest burn centers in the country. There are pediatric patients here, adult patients here. You know, one of the questions that came in was, when you're healing a burn patient, do they still feel hot, and how do you keep them comfortable? And this question was from Heidi and Felicity.
There are no easy ways for that. It really is about keeping your environment a little bit cooler. Mm-hmm. So in the early stages, burn patients, particularly with larger burns, have a tendency to be cold. So we, here in the hospital and the clinic, as you might notice, the temperature is usually in the 80s. And that way it helps when people are losing heat, particularly when their skin isn't closed yet. Once the burn is closed, then people have a tendency to get hot easily. And the thing for that is a little lighter clothing and, you know, lowering the temperature in the house, using a fan, those type of things. Mm-hmm. We actually have a research center here looking at heat tolerance. Mm-hmm. So we're doing some studies to actually look at how people tolerate the heat. And it looks like most people with less than a 40% burn, 40% of their skin surface burned, are able to dissipate heat. But they're still uncomfortable. And the things we've learned is the best thing to do is to listen to your body. And if you're starting to get lightheaded, if you're sweating a lot, if you don't feel good, then you really should go indoors, cool down, drink, sports drink and some water to really cool down the core temperature.
Okay. So if you're still warm, I know you mentioned running water, no matter the temperature, does it help to wrap like a cold paper, a wet paper towel around, or does it not really do anything?
So it probably doesn't do anything because it holds the heat in. Mm-hmm. So it is the motion that dissipates the heat.
Okay.
The other thing is that you don't want to use anything that's real cold, because that causes vasoconstriction and actually can make the burn worse. Oh. So the one thing you don't want to do is to put ice on a burn.
Okay, that was actually another question that came in advance. They were wondering, should I put ice on a burn? Or I think this was from a long time ago. They said their grandmother used to put butter on a burn, and that sounds like probably a really bad idea.
You know, butter is a problem because it has a very high sugar content, and so it really increases the risk of infection. Okay. So running water until it's sort of calmed down, and then antibiotic ointment.
Okay, all right. So let's see. So what is, and this goes, we've addressed this many times, but what is the best medicine for a burn injury?
So it depends on how big the burn injury is, the location on the body. Mm-hmm. For very small burns, antibiotic ointment is fine. Mm-hmm. The over-the-counter one is a triple antibiotic, which is really fine for most small burns. We have a tendency to use a single ingredient antibiotic just because it decreases the chances of developing an allergic reaction to the ingredients. Mm-hmm. Silver sulfadiazine is a very old medicine, also known as Silvadine, that we have a tendency to use on much larger burns.
Okay. So one of the things that we talked about before our chat started was the different types of burns that different ages get. And what I'm wondering is, for the parents that are watching this chat, like, what should they do to prevent their children from getting burns?
So there are a few very basic things for preventing burn injury. The first thing is to look at your hot water heater.
Okay.
The low setting on the hot water heater is usually about 120, and with that it takes 10 to 20 minutes of direct contact to get a full thickness burn.
Okay.
On the high setting of the hot water heater, 175 takes less than 20 seconds. Most people say in the 2 to 3 second range. So if you have young children who are likely to turn the water on their own, you want your hot water heater set on low.
Okay.
The second thing, particularly for children under 5, is to keep them out of the kitchen. Now, that sounds really easy. It's really impossible. I have children. They were always in the kitchen. But I think
they always want to be in the kitchen.
You need to have just a little extra awareness of where they are. The things you've learned in school about turning the handles of the pots to the back of the stove so they can't reach it, and keeping hot drinks out of a place where they can pull it down. We've certainly seen children pull down a cup of soup, hot tea, any of those things. And it's the 1 to 3 year olds who are trying to reach up a lot and grab things. We've also had children pull stuff out of the microwave and spill it on themselves. Yeah. So it really is sort of helping them learn how to manage things that are hot.
Okay, that's some good advice there. So we've got a question. So Crystal is wondering, thank you, Crystal. She says, are there special considerations for burn patients who have diabetes? Does that play in?
It certainly does. So for a couple of reasons. One is people with diabetes have a tendency not to heal as well. So there's a lot of things we have to do to facilitate wound healing. the next thing is that people who have long-standing diabetes have decreased sensation or peripheral neuropathy with numbness in their feet.
Okay.
So they're at very high risk for burns on their feet from being near a heater, soaking them in hot water. We've had people go get a pedicure and that didn't pay attention to the water. So that's a very important thing. The other thing is that the burn injury itself causes insulin resistance. So it actually causes injury-induced diabetes where the blood sugars are raised. So in the acute setting, we often have to use insulin for someone who might not need insulin at any other time. Maybe analogous to pregnancy-induced diabetes.
Okay, that makes sense. Wow, I had no idea about that. So we're going to go back to the different children. So you mentioned little children. You know, we're going into the 4th of July holiday. A lot of people are going to be camping, they're going to be grilling. What are some considerations there?
So essentially for everything with burns, it's about paying attention. So fireworks are very hot. So we think no lay person should ever have a commercial firework. Leave it to the pros, let them handle it.
Okay.
Everyone wants to have sparklers. You need to know that the tip of the sparkler, just a touch of that will produce a burn. And young kids have a tendency to do that a lot. We have a lot of injuries with firecrackers that misfire, Roman candles. So it's about being very diligent about that, and sort of excellent supervision of children. Children should not have fireworks without supervision. So it's very important that the parents stay close by. The other challenge that we have are with bonfires, and that's sort of an injury of late teenagers, young people.
College age.
Yes, college age. Usually there's drinking involved, and people are excited. There are lots of people around, and they have a tendency either to try and show off their bravado by jumping across the fire, or they're just joking around. They slip and fall, and those are devastating burns.
Yeah, those can be. I've known people to suffer those. So before we go any farther, I want to thank everybody for the questions that have already come in, and thanks to Parkland for helping promote this chat and the Survivor Foundation. We appreciate it. We're getting some more questions in, so keep them coming. We're about halfway through the chat, so if you've got a question, now is a good time to put it in there. So this one
other thing was just the propane grill is if you turn it on and it doesn't light, turn it off, wait a few minutes, let the gas dissipate before you go back and try to light it again.
Okay.
The other thing is if you're using charcoal, never put gasoline on it. So what people don't understand is that the fumes of gasoline burn. So if you pour gasoline on something and you light it here, you can actually burn someone who's not even close to you. So there's just no place for gasoline in starting fires.
So what do you recommend people use? Just
lighter
use
fluid,
a match, paper?
Match, the artificial starters. Lighter fluid you still have to be careful with, particularly if you're trying to squirt it out of the can, because the fire will come up the stream to the person holding it in their hand. So you're better off using fire starters.
Okay. So use fire starters. That's what we use in Girl Scouts.
Yes.
All right, so let's see. We've got another question. They say, are areas that have been burned by a 2nd or 3rd degree burn more sensitive to future damage?
Yes. And, to sort of differentiate the layers of burn. So a 1st degree burn is skin that gets red but doesn't peel. A 2nd degree burn is a burn that burns through the epithelium, which is the very top layer of the skin, and then into the dermis, which is the 2nd layer of the skin, but not all the way through the dermis.
Okay.
So those can vary from something like a blister to a burn that burns all the way down to the hair follicles that might need a skin graft. 3rd degree burn burns all the way down through all the layers of the skin and mostly requires a skin graft to heal.
Wow.
So a blister, once it heals, may not be more sensitive, but those deep 2nd degree burns and the 3rd degree burns, the skin's never normal again, so it is predisposed to being torn. Full thickness burns that require skin grafting don't have normal sensation, so if you set them on something hot or you bump them against something, they can be injured again.
So in that case, I mean, obviously you have different treatment methods here at Parkland. What are some of those options for if somebody's in that situation? How are they going to be treated?
So for the blister, there's a huge debate about whether you take the top off a blister or not.
Yeah.
I'm in the school of popping the blister and draining it, but trying to get that skin to stick back down.
Okay.
Because if it sticks back down, it doesn't hurt as much. And that's particularly important in kids. That's a burn pattern we see common in kids. They touch the the screen in front of the fireplace, they touch the stove, they touch the iron, and so they'll come in with a blister on that, and we just drain it and try to get that skin to stick back down. Once that skin peels off, you can use antibiotic ointment. There's some more advanced wound care products that you can use, but probably don't make that big a difference in healing. If it goes through all the layers of the skin, then you need an operation to get it to heal.
Okay. So one of the things that's out there that I talked to you about this before, because this is just fascinating to me, is that at other hospitals around the world, they're using different methods to treat burns. In some parts of the world, they're using tilapia skin, I believe, as a wrapping. What does that do, and what's the science behind that?
So it really isn't a burn treatment. It really is just a type of dressing.
Okay.
So the only skin that will heal a burn that's through all the layers of the skin is your skin.
Your skin.
So anything that isn't your skin, you're just using as a dressing.
Gotcha.
So there are some products that we use for that. In the U.S., we most commonly use pig skin.
Okay.
It's readily available. It comes in big sheets. So on a wound that's clean, and it has to be a second-degree burn that's clean, you can put the pig skin on and it'll stick. And then as the burn heals, it'll separate off and you can trim it off.
Okay. Does it work? Now, this is a very crude up. Is it similar to, you have a blister, you maybe put moleskin, or you put moleskin on to prevent blisters? Does it work similarly, or?
It works more like your blister skin that's dead, but covers the blister until it heals.
Okay. So are there, now this one, I don't know if this is something you can address, but are there changes you can make to your diet to promote healing if you've had a serious burn? Is there anything you can do in that side of it?
Absolutely. Nutrition is really important to burn healing. So the most important thing is to make sure you're getting enough protein, because that facilitates wound healing. Okay. Controlling blood sugars, high blood sugars interfere with healing. Zinc helps with healing, and more particularly sort of avoiding things that are going to make it worse. Alcohol, concentrated carbohydrates that'll raise your blood sugar. So it really is about good, well-balanced diet, extra protein, good multivitamin, and maybe some zinc.
Okay. So I'm intrigued by this. What is the extra protein? What does that do in the healing process?
Yeah, you just need the protein to help create the cross sections for healing.
Interesting. Okay. All right. Let's see. We're going to keep going down the questions. All right, go down. We've got one. We answered the one from Valor. We have the one from Andy here. So tell me about your research that we do at UT Southwestern. I know you're involved in the North Texas Burn Rehabilitation Research Center.
Yes.
So what are some of the projects you have underway?
My main area of interest is to see how people do after a catastrophic injury. So 20 years ago, we thought once your skin was healed, you were fine. And what we found out is that that's not really the case. That it takes many years for individuals to regain their strength and endurance. The skin isn't normal, so you're predisposed to skin tears, to pulling of the skin, and there are a lot of psychological issues associated with catastrophic injury, and those persist as well. The things we're starting to learn now are things about osteoporosis, about kidney changes, about heart changes. So we're really trying to look at what happens at 6 months, 1 year, 5 years, 10 years. And that really has come out of a very close engagement with burn survivors. In the 60s and the early 70s, we were so interested in survival. And now the majority of people, even with a catastrophic burn injury, survive. And so now we have to start paying attention to what happens after you leave the hospital. And the very best source of what things we should study is really our burn survivors. So we have a support group here that meets once a month, and we get feedback from there. And we also have a group called SOAR, Survivors Offering Assistance in Recovery. And they're trained peer counselors who provide support to people in the hospital and after discharge. So those things have really helped us get a better handle on what people are going through later on in life.
Right, and there are also burn camps for children to go to.
We just got back from our burn camp at Camp John Mark. It's called Camp Itonkachi. And it's interesting, early in my career, an adult actually said to me, "You are very empathetic and you know a lot about burns, but you don't know what it feels like." And no matter what we all try to do or think, we don't know what it feels like. And one of the things that burn camp does is to get the kids together with other kids with full thickness burns and who have been through this to say, what does it feel like? what are you experiencing? And that exchange of information, a sort of how do you date? What do you tell someone at school? You know, those type of things.
That could be challenging. So are burns, I guess, are they more common among children? Are they more common among adults, or is there no age?
It depends on what type of burn.
Okay.
So if you look at injuries from house fires, those injuries are in the very young, the very old, the disabled, and people who are intoxicated. If you look at injuries in the kitchen, it's the very young and the very old. If you look at work-related injuries, it's 20 to 40-year-olds, mostly in manual labor type of situations where there are explosions, you know, working the oil fields, those type of injuries.
Gotcha. Okay. All right, so we're going to go back a minute because they came back with a follow-up question. So you were talking about, you know, that sometimes burn patients they're actually cold. Why is that? You would think they would be that they feel really hot, but they're actually cold.
Yeah, so some of it is the changes in how the metabolism works and how it's working on wound healing. So, you know, everyone's a little bit different. Some people are really cold and some people are really hot, and it just depends on how your thermostat's reset post-injury.
Gotcha. So pay attention, Heidi and Felicity. All right, we got one other question. So somebody talked about, they said that and this gets back to the butter thing, but they're wondering more now about flour, putting flour on a burn injury. I don't know what that is.
I don't think it will help at all. The biggest thing of sort of thinking, and flour triggered this for me, is that one of the things that I just absolutely want an educational effort out there is about grease fires. So you're cooking and the grease catches on fire. Everyone, even people who know better, think you should take that outside. And we've had all sorts of devastating consequences from that. We had someone who spilled it on the top of their son's head. We had someone who spilt it and fell in it. And a lot of people make it to the door and they hit the door with so much energy that the door springs back at them and then dumps the grease back on them.
Oh, wow.
All of those are bad. Having your house burned down is better than having a burn. Let me just say that up front. So the first thing, turn the heat off.
Okay.
Slide it off the burner. If it's still going, you can try to put the lid on it or to put flour on it.
Okay.
Don't put water on it, it'll make it worse. But taking it outside notoriously causes problems. So just know that's not a good solution. And people with those burns oftentimes require operations and a long time in the burn unit. So take it off the fire.
Okay. So
put a lid on it.
Yeah. Grease fire. So you want to take it off the fire, turn it off, maybe put flour on, put a lid on it, but don't take it outside.
Right.
All right, that's good advice. All right, something similar. So Crystal, she says, are chemical burns treated differently from temperature-related burns?
They are, depending on what the chemical is.
Okay.
So we know that alkali burns are much deeper than flame burns or acid burns. So those have to be treated very carefully, and you have to watch the acid-base balance in the body.
Right.
The other thing that is very dangerous is hydrofluoric acid. And that actually disrupts the calcium and actually can cause the heart to stop. So you have to treat that with a very special topical calcium. So for those people who work with hydrofluoric acid, which is used in etching and some car-related things, very dangerous. And if you get that on your skin, you need to go to the ER right away.
So should chemical burns, if somebody has chemical burns, should they always go to the ER or always seek medical attention?
Yeah, almost all chemicals you should flood with water, but obviously if you work in an industry, whatever is posted as far as managing that acutely, but yes, chemical burns should be seen in an emergency room.
Okay. All right, we've got a note from a Jeff Patterson. He says, you're awesome.
Hi, Jeff.
Thanks for sharing. No, okay, so chemical burns you always treat. Temperature-related burns, they always go to a medical facility. It sounds like for temperature-related burns, it depends on where it is, the location, the size.
If you touch your finger on the stove and get a blister, that probably does not need to be seen. If you get a grease burn on the back of your hand, you definitely need to be seen. The skin on the back of the hand is very thin, and even a small burn will go through all the layers of the skin. So that's something that's very critically that you are seen at a burn center.
So I guess that's a good question is, I'm assuming you can tell from looking at it that I need to go to a doctor?
I think it's hard to know. And if you don't know, you're much better off seeing a physician so that you can be evaluated and know for sure. So if you have a question, be seen, because that's really the answer in getting you the information you need.
Okay. Oh, you've got lots of fans now. Let's see, Laura McCullough, Vern Miller, they're all chiming in. All right, so we've got about 3 minutes left, so now's a great time to get any last minute questions in. In the meantime, I think we should reiterate kind of when you see a doctor is if it's bigger than the palm of your hand, if it's a grease fire, it sounds like, and if it's in other parts of your body.
Flame burns.
Flame burns.
Hot contact burns bigger than your palm.
Mm-hmm.
Anything on the back of your hand.
Okay.
Anything on your face.
Okay.
Anything on your genitalia or your feet.
Right.
Are the main ones. And then just some prevention tips while I'm here. Change your smoke detector batteries.
Yeah.
So for reasons I cannot explain, it always starts to beep in the middle of the night.
Yeah,
and then you get up and you take the batteries out and then you don't replace them.
Yeah.
So that's a huge problem, is to make sure you change the batteries regularly. The other thing is about adding gasoline to the lawnmower.
Mm-hmm.
Remember, those fumes burn, so you pour the gasoline in and you can actually see them, and then you start the mower and those fumes burn.
Okay.
That's why it's so dangerous, why you shouldn't smoke at a gas station. Turn the hot water heater temperature to low.
Right.
And be careful with the kids in the kitchen. And
right.
Obviously for this weekend, lots of care around bonfires and around fireworks.
All right, we've got a time for 2 more questions came in. There's going to be the last 2 we're going to take. We've got one from Tim. He says, after a burn, contractures often happen. Would you speak to where are the major joints usually affected, and what types of rehabilitation occurs to prevent contractures?
So,
good question.
As burns heal, the skin shortens,
mm-hmm.
and it pulls the skin down so that you can't move completely. The most
mm-hmm.
common is in the axilla or the armpit.
Okay.
And so when people are first injured, we try to position them with their arm up in the air.
Mm-hmm.
It's hard because that hurts a lot.
Yeah.
And so we try to get that stretched out, but that's really the thing, is sort of positioning in the position where the skin is on stretch.
Mm-hmm.
And then lots of exercise, lots of therapy afterwards.
Moving.
Yes, and oftentimes people need an operation to get the additional skin they need to get full range of motion.
Okay, good question, Tim. And then the one from Laura. She says, you mentioned the hot water heater turned down. Can you mention why in regards to diabetics and foot burns?
So it's the same thing that I was talking about before, is how quickly you can get a full thickness burn. And people with diabetes who don't have normal sensation don't turn the water on hot and don't feel that it's actually as hot as it is, and they run it over their feet that are numb, and they end up losing their feet. So it's very important. And same with children. They just can't get out of the way fast enough when it's really hot. So that hot water should stay at low.
Okay, that's good advice. All right, well, I think we are, let's see, 12:30. We are all out of time.
Okay.
So I want to thank you for joining us, Dr. Kowalske, and thanks again to Parkland for letting us use the Burn Center Clinic. This is an amazing facility. Hopefully nobody will never have to visit it.
Yes.
But we do appreciate it. And stay tuned. We are not having a Facebook Live next week, but we'll be back in a couple weeks with a couple different topics. So stay tuned for that. And thank you again.
Thank you very much. It's a pleasure.